On this page, I'll focus in a bit on schizophrenia. Neuroinflammation is a pathologic contributor to schizophrenia, and we know that GI dysbiosis is a major cause of neuroinflammation. Schizophrenia patients, as I mentioned previously, also have oropharyngeal dysbiosis, but the pathologic significance of this has not been elucidated, such as in a clinical trial using antimicrobial treatment, such as a povidone iodine lavage or gargle. Up until the 1920s, the medical profession used colonics and enemas to treat psychiatric illness. Then, according to Jeffrey Bland in his program Advancement in Clinical Nutrition around 1995, when surgery fell into favor and then out of favor, enthusiasm for the autointoxication paradigm waned, but this, of course, did not indicate its lack of importance. Obviously, popularity is different from clinical significance, so it did fall out of fashion, but it was never refuted. Again, we know that GI microbes produce neuroinflammatory and neurotoxic molecules. Let's take a look here at a recent clinical trial. This is from Biomarker Insights 2015, Immunomodulatory Effects of Probiotic Supplementation in Schizophrenia Patients, a randomized placebo-controlled trial. Basically, what was shown in this study is that probiotic administration could lead to a reduction in inflammatory mediators. It did not, however, result in improved symptomatology in these schizophrenic patients. So in other words, we see biochemical benefit without clinical benefit through the simple use of probiotics in schizophrenia patients. Now let's take a look at some of the historical data. This is from the New England Journal of Medicine, 1932, discussing the use of colon irrigation in the treatment of mental disease. You can see that they emphasize the use of colon irrigation for mental disease, but also note benefits in arthritis. The authors note that colon irrigation cannot be expected to produce permanent results unless focal infective areas and other parts of the body, when present, are found and removed. These authors note that many mental conditions and some forms of asthma, neuritis, sciatica, gout, and rheumatism are benefited, again, through the use of colon irrigation. Now let's focus in on a few excerpts from this article. Toxic substances such as phenol, cresol, indole, and scatol, and also hydrogen sulfide. You'll notice that I mentioned virtually all of those in previous conversations. We just talked about p-cresol. Indole is the bacterial degradation product derived from tryptophan degradation. And I also talked previously about the mitochondrial toxic effects and neurotoxic effects of hydrogen sulfide. These products, when reabsorbed, are detrimental to the living organism and produce nausea, vomiting, diarrhea, headache, and mental disturbance in varying degrees. In our experience, cases of manic depressive psychosis experiencing a manic episode show a quicker return to normal mentality when the colon is kept well irrigated. And in summarizing their experience, the authors state approximately 200 colon irrigations are being administered monthly at the Garner State Colony. No untoward results have been noted in any case. Generally, they used tap water, but occasionally solutions of sodium bicarbonate, saline, and tincture of green soap. They note that the quantity of fluid used during an irrigation will vary from 10 to 20 gallons, warmed to a temperature not to exceed 110 degrees Fahrenheit. The volume of the irrigation is determined by the clinical response. The rule should be to wash until a clear return is obtained, irrespective of the amount of fluid used or the time consumed, being governed by the general condition of the patient. Now let's look at a similar article from this era. This is from the Boston Medical and Surgical Journal. A consideration of the treatment of autointoxication or autoinfection, whereby they are the cause of mental disturbance. Again, emphasizing the use of colonic irrigation, what they describe here as daily colonic flushings. Toxins do exist and are the most potent factors in many disorders of the brain. And the author closes by stating, the above conclusions I consider are justifiable as the result of my work shows, and they are supported by the testimony of many other physicians whose preeminence cannot be questioned. So obviously for many physicians, this was the accepted treatment of choice back in the early 1900s. It fell out of favor for a while, but is now falling back into favor as we see increasing evidence supporting the role of the gut-brain axis in various neuropsychiatric conditions. Now let's take a look at bipolar disorder, neuroinflammation from the gut. The severity of bipolar disorder is proportionate to serum levels of inflammatory markers. The inflammatory source appears to be low.